Okay, hopefully everyone can see the screen here. And so let's get started. Lots to cover. Like I mentioned before, we're going to be discussing the latest developments. So if we're looking at the WHO dashboard over here, we can see significant COVID-19 disease worldwide, right? We know the virus is prominent and dominating the entire globe. We've been in this for about 2 years now, and there's really no region in this world that's really been untouched by COVID-19 as by SARS-CoV-2 and the disease that it causes, COVID-19 at this point. If we want to just look at what's happening specifically in the US, we can see the trends during the course of this pandemic, starting from 2020 and our first wave. And, essentially at every stage, we've had some high peaks and we've had then plateauing and, steep declines as well in certain surges. And most recently, when we had Delta and we slowly plateaued out of Delta by the end of the summer, we started seeing cases coming down a little bit, but unfortunately, we can see that cases are continuing to climb at this point, and that is not surprising because we were essentially expecting that with the winter season, with people moving indoors, with the changes, just seasonally being in crowded indoor settings. And we know we've learned so much about this virus and the modes of transmission and how we have much more transmissibility. So this is just not surprising with the holiday time, with the travel and the time of year. So COVID-19 is on the rise in our country and globally. As I said, nationally, we have seen different areas of our country where we're seeing increasing cases. We're averaging roughly around 100,000 cases a day, but we've seen when we're averaging this out that there's been certain weeks where we're having lower reporting in cases. But for the most part now, especially as we just came out of Thanksgiving and heading into our Christmas and New Year's holidays, we are seeing a far greater number of cases than that. And this is still lagging behind because of a delay in reporting because of specifically the holidays that just passed. But we have an average of, about 58,000 people who are hospitalized right now. We're averaging roughly about 1,000 deaths per day. So, these are really high numbers. We knew this was going to happen. We are really in our surge with Delta right now, but it is a little bit concerning that we have so much widespread disease, not just in our country, but throughout the world as well. And what's interesting is that there are certain states that are reporting more cases in our country right now. And that's very, very interesting because we've seen that the South has actually really cooled off at this point. They had significant surges in the summer. We saw Florida, we saw Texas really just rampant with COVID-19 cases. And now we can see in different regions of the country, specifically in the North and the Northeast, we can see New Hampshire is actually reporting, significant amount of cases right now with, according to CDC, their positivity rate is about 13.4% at this point. So what's interesting globally, we are hearing so much about this variant in the news, and we will go into a little bit of detail of why this happened and what really alerted us. So we saw South Africa actually had really plateaued down and decreased in their cases. And all of a sudden they noticed a little blip in their case activity. And the researchers and scientists over there were very much in tune to this and very quickly started seeing a rather sharp incline in their cases, even though it was very small initially. And they really were very cognizant of this and started paying attention to what was going on. And this was something new. And they used their scientific processes to their advantage with the real amazing genomic sequencing and surveillance that they have going on in that country, where they started seeing and tracking these. And they very quickly started doing sequencing and noticed something very unusual with this. And they started seeing that this one particular variant, essentially was outcompeting the others. If you look at Delta and Beta. And it was really interesting because very early on, they started noticing that there was a S gene dropout in this. And that was something that really put them into a notion of knowing that they're dealing with a new variant. And once that variant was sequenced, they very quickly shared this information with the global community. And this was really important because what they found was was this new variant that was sequenced out, was actually a little bit concerning because it has significant amount of mutations, more than what we had seen before. We've had Delta variant before that was more transmissible than our Alpha variant, and we were concerned when Delta had about 13 mutations, more. But now we're looking at this, and I'll show you again this picture right over here. If you're looking at the two different variants of concern, Delta versus Omicron, you can see that the Omicron variant actually has about 50 mutations, and more than 30 of these are in the spike protein. So this was really, really interesting phenomenon, and didn't really know what to make of this initially. So going back in our timeline here, South Africa has actually identified this new variant, and it's been given the name of B11529. And initially, the first reported cases were around the 25th of November. This information was relayed to the WHO. And this was being tracked and monitored very, very closely. And once we had the phylogenetic tree of this, we can see all those mutations and what does this exactly mean in the context of disease. Well, we very quickly started seeing the disease really taking off. And I just want to go back very quickly to the WHO's definition of variants, just to remind everybody as a little refresher of the different classifications of variants that we have. All right, so we have variants of concern, and these are variants that have affected us globally throughout this pandemic. We had the original strain, the wild type Wuhan strain, and then after that came our first variant of concern, which was the Alpha variant B117, which was first described in the UK, followed by Beta and Gamma and Delta, which is predominant strain and variant globally right now, and that was most recently what we've been having to deal with. And then now that this new variant was first identified in South Africa and Botswana and Hong Kong, very close together, was given the name Omicron. Okay, so this became a variant of concern very, very quickly, just due to the sheer fact of the number of mutations that this variant has and where these mutations are. So that's also something that's important to look at. And I'll share that going back again to our picture right over here of our variant and the number of mutations that we have here. As I mentioned before, it was identified because we had that S gene target failure, okay, and that was previously seen in Alpha as well. But now, along with that, we have multiple mutations now on the receptor binding domain. We have mutations on the spike protein, so many mutations altogether that what does this exactly mean for us? And that was the big question. So the good news is that our testing right now is targeted towards these specific variants. They are not missed by our current testing strategies, and that's because whether it be molecular tests such as PCR tests or antigen tests, they are essentially derived at multiple parts of the virus. And so that's why we're able to really identify this variant. And that's essentially how it was initially picked up, because they were able to see the variant, except that they saw that there was something unusual with it. And then they dug a little bit deeper into that and looked at the sequencing for that. All right. So that's important to remember, is that even with an antigen test, because this question comes up quite frequently, are these antigen tests going to, in fact, miss this new variant? And at this point, there's no reason to believe that, because the nucleocapsid of the virus is being tested in those. And so therefore, we do have testing modalities that can quickly identify this new variant of concern. This is just the variants of interest by the WHO that were previously categorized, Lambda and Mu. And then these are the variants currently that are under monitoring. Now, interestingly, I will just also mention why this variant was actually named. This question comes up a lot. Why was this variant named Omicron? And, we know that WHO is classifying these by Greek classification. And most people actually thought that this variant was going to be named New, because that was essentially the next letter. But New was very similar to Mu, which is recently labeled as variant of interest. And so they thought that there would be a lot of confusion with that. And the next letter essentially was Z, XI, and that carries a lot of cultural stigma. And so they wanted to make sure that this variant was not labeled in that manner. So that's why WHO came to that decision to name it Omicron. Now, if we look at the global perspective on what's happening in the world with vaccinations, we can see that there are significant disparities. There are significant inequities in vaccine uptake throughout the world. About 55% of the global world has received at least one dose of the COVID-19 vaccine. What's interesting to note, if you look at the darker greener areas are where there's been, significant vaccinations, and the lighter yellow areas is where there really has been very little vaccination. And you'll see, and you'll really appreciate that only 6.2% of people in low-income countries have received at least one dose of the COVID-19 vaccine. So that is really alarming. And just if you look at the significant vaccine inequity that we have globally and the amount of disease that we have, if you go back to that first slide that I showed you with the amount of coronavirus, SARS-CoV-2 that there is in this world, it is not surprising that a new variant has emerged just because of the sheer fact that we just don't have enough people protected at this point in the world. This is, again, just a statement from actually the South African National Institute for Communicable Diseases, which reported that there was on December 4th, there was about 16,366 new cases that were identified in South Africa. And, this increase that they're seeing is really a rapid increase in cases. And it's their positivity rate has gone up to about 24%. Now, we're talking about in just a matter of 1 to 2 weeks. So this is a really important thing to keep in mind, and we are focused on this in the global scheme because what's happening in South Africa and what's starting to happen in Europe, we don't follow far behind, and that's, I think, something that we have to really keep an eye on. The whole world has to keep an eye on, because in the past 2 years, if we've learned anything, we have seen how much we are really connected in this global community. This is just, again, from the South African Health Department showing the cases and the rates that they have of SARS-CoV-2 in their communities in different cities. And if you look at specifically, these are the different areas in the country, and if you look at the activity of COVID-19 in the country, what specifically, if we just look at the Gauteng region here, we can see that the positivity rate, as I mentioned before, has really climbed significantly. And you see this peak, this very sharp peak happening in cases, and this sharp incline that's going up here. And this is what is really being, monitored right now. And you'll see here this little blip that started out that way, and we'll be watching this closely, but we know already that the positivity rate is really climbing in this country and other countries as well, as we identify more and more cases of this novel SARS-CoV-2 variant. Now, the Omicron variant was also, it's really important to remember that although it was first described in South Africa, and it was first also simultaneously described in Botswana, and unfortunately, the entire world started having sort of a knee-jerk reaction and having these travel bans that were put in place. Just because the variants were described there first doesn't actually mean that they emerge from there. We already know that from all the genomic sequencing that's happening globally at this point, that other countries in Europe have already reported these cases. And in fact, in Netherlands and Belgium and Germany, they've actually reported cases of this strain, this variant, that predates the cases that were first described in South Africa. So, they had looked specifically at samples of patients in these countries, and they found that they had previous cases. It's just that, if you don't look for it necessarily, you may not find it. So this really points to the fact that we definitely had community transmission happening globally. Now, what does this mean with respect to what's happening with people that had natural immunity? So another really interesting thing that's happening, a trend in South Africa that we're keeping a very close eye on, because again, everything that's happening right now is happening in real time. So things are constantly changing. The world is watching very, very closely, and we're all keeping an eye on this because there are many, many questions that are unanswered at this point. So an interesting preprint that just came out was looking at the increased risk of SARS-CoV-2 reinfection associated with the emergence of Omicron variant in South Africa. So what they found is, if you look at this Right here, I'll show this graph here. These are these colored boxes essentially represent the 3 different waves of SARS-CoV-2, COVID-19 infection that the country had dealt with. The purple box is wave 1, the pink one is wave 2, and the orange is wave 3. And if you look at the population that's at risk for reinfection, in this preprint study, what they found was that within 90 days, they're actually finding that people are more likely to be reinfected with this Omicron variant than the other variants that presented before in the other waves that the country had dealt with. So specifically, they were finding that as compared to Beta, where there was probably about 12% risk of reinfection, and Delta, where there was about 9% risk of reinfection, they found with the Omicron wave that there's roughly about 25% relative risk of reinfection. So this is a really significant finding. Again, this is a preprint, this is early, this is all being watched in real time, and we'll have to see if this really pans out. But what this really means is that people cannot really rely on immunity from natural infection, that, this is why vaccinations are so key. And this is why even if you've been infected with COVID-19 before, with SARS-CoV-2 before and had COVID-19, that you really should get vaccinated, because that will give you a much more robust immunity and much longer lasting immunity and prevent you from getting reinfected. Again, some characteristics that we want to look at for this variant specifically and what's happening in South Africa. This is specifically some data from South Africa Health Department. And this is really looking at what's happening with the demographics, who's hospitalized right now, who's getting sick right now. There's so much that we just don't know, and we are just watching and waiting to see what pans out with this new variant. What's interesting to note is that initially, most of the people that have been infected in South Africa have been younger, and initially, a lot of the virus was really being transmitted amongst college-age students. So we do know that younger people generally do have milder symptoms. So it's still anecdotal. That's what is being reported initially, but we don't know if that necessarily means that this variant will essentially most people will have milder symptoms. We have to just wait and see, because usually the second wave after that is when the older, more at-risk community members and population is affected. And again, all of this demographics really varies by country, by region, so it's very different. So not only do we have to keep an eye on South Africa, but like I said, we have the entire globe that essentially this variant has been detected in. So we have to keep an eye on countries, throughout the world and see what's panning out with this variant. But interestingly, you will see here, if you look at the 3rd wave versus the 4th wave for South Africa, which is the orange, you will see here that there is significant more infections being reported in the 0 to 4 age group. And you can see here really younger population at this point. These are the people essentially that are even, some of these people are even being hospitalized. But again, it is too early to tell. We are still collecting this data in real time. So will be interesting to see is, are these people having severe disease or not? And again, from the data so far from the hospitalizations, what we know is that majority of the people who are hospitalized in South Africa are still unvaccinated. So I think that is a real key right now. But again, we'll have to just wait and see what's happening globally with that. Now, if we look at the rest of the world, we know that there is significant disease throughout the world, as I mentioned before, and there's local transmission happening in the world everywhere. You see so many countries at this point, just as of Friday, there were about 38 countries that were reporting Omicron being detected, and just now we're up to 45 countries as well. So this is going to continue to climb. This is not a surprise at all. This was expected. We live in this global community, and we are not surprised that this variant is essentially detected everywhere, including our nation. And that's because, community transmission is believed to be widespread at this time. And we are starting to see those trends in Europe, and we'll have to wait and see what happens in the US as well. And looking specifically at the US, these are the states that are reporting Omicron detection at this point. But like I said before, we are expecting these numbers to go up as well, because we are doing more genomic sequencing. Our country is roughly at about 5 to 7%. which is an increase from before, but it's still not as high as it needs to be. If you look at globally, the number of countries that are doing genomic sequencing, it's really far greater than this. And really, we do owe a debt of gratitude to our colleagues in South Africa for being very, very astute about this and sequencing this new variant and really alerting the world so that we can be better prepared for this. Now, what's important to keep in mind is not just nationally, but even globally, although there is, every day we're hearing about more and more detection of Omicron variant globally and nationally, we still have very much a wave of Delta going on in our nation and throughout the world as well. So 99.9% of our cases right now are due to Delta. And you can see, as I mentioned before, we're averaging about 100,000 cases going on per day. We have over 1,000 deaths per day. We have about 58,000 people in hospitals. And most of that primarily is being driven by Delta. So we really are in a Delta surge right now. We are keeping an eye on Omicron to see what happens. Will this outcompete Delta? We just don't know. Will there be two variants, circulating at the same time? We don't know. Or will Delta continue to outcompete Omicron? Only time will tell. But this is exactly the scenario we're in right now, where there's a lot of unknowns. And with time, a lot of these things will become more obvious to us. Now, moving on to vaccinations and boosters. We talked about this before. What does this mean for our current vaccines? What does this mean for the future? So if we look at our country right now, we have roughly about 198.6 million people who have been fully vaccinated. That's about 60% of the population. This is CDC's data from December 4th. Again, this data is a little bit outdated. We're, expecting these numbers to be a little bit higher, especially in the past week or so. We have been seeing a lot more increase in vaccination uptake, partly because people are concerned with this new variant that's circulating. And if we look at boosters, we've had a lot of discussion from the FDA to the CDC about booster vaccinations and who should receive boosters. So again, we were relying a lot for amazing research from the global community and from our colleagues abroad who told us initially about the waning immunity from our vaccinations. And if we did not have the surges that we did with Delta, whether it be in the summer, if you remember in the spring with our vaccination efforts in early 2021, we had really brought the case levels down significantly, where we were in a really good place in our country until Delta really started taking off and we started seeing our summer surge, and we saw what was happening in the hospitals throughout our country. We saw the effect on the pediatric population, and we started seeing waning immunity. So first came the recommendation for people who are immunocompromised, who really could not mount that response to these vaccines, and they were eligible for boosters. After that, because of the context of Delta, where there's so much virus present in our communities, and tie that in with a little bit of waning immunity from these vaccines, we started seeing more and more breakthrough infections, and we started seeing people who had underlying medical conditions being susceptible to having a little more severe disease and possibly needing to be hospitalized. And that's where the recommendation came to really have boosters for people who are high risk of severe disease, as well as boosters for people who have high exposure who can then contract disease. And so the boosters were then rolled out. However, we saw that the booster uptake was still not robust. People were getting boosters, but it was nowhere near, the way that we had the primary vaccine campaign. And then soon after that, with more and more waning immunity, more cases, and current surge of Delta, and with this new variant that has emerged, really the recommendation was made that everybody 18 or over should really get a booster vaccine. And if you've had the mRNA vaccines, such as Pfizer or Moderna, and if it's been 6 months since your second dose, then you are eligible to get a booster. And if you've had the Johnson & Johnson vaccine, and it's been 2 months since you received your dose, then you really should get a booster. Now, this is based on data from these trials that has really shown that, with every variant that has emerged, our vaccinations have taken a hit on their efficacy. They are not at that 95% efficacy that we had with our wild type virus, but what's been really good is that despite the decrease in efficacy of our vaccines, they have still provided really good protection against severe disease and hospitalization. We saw that with Alpha and we saw that with Delta, where we didn't need to use a variant-specific vaccine because these vaccines were still providing significant protection. But with the waning of immunity and with studies being done on third doses and boosters, we saw that the amount of immunity that's boosted from these third doses for mRNA or second dose for Johnson & Johnson really brings you back up to that 90%, 95% range. And it should give you even more long-lasting immunity. And that's why the recommendation was really made there. So if you look at the percent of people who have received booster doses at this point, you can see that it really is not that many people in our country. So it's roughly about 20% of people have received boosters at this point. And this is, again, just a study that had come out looking at mixing and matching of boosters. I know this question comes up a lot. There's been studies that have been shown efficacy for staying with the same vaccine and boosting it with the same series, or mix matching vaccines. And really at this point, it's been essentially left up to people to make, for the ease of administration, to make sure that, for example, if you had received a J&J vaccine and you show up to the pharmacy for your booster and that day Moderna is being offered, instead of you leaving and not being able to get your vaccine, we know that all of these vaccines will augment your immune system and give you really robust and long-lasting immunity. And so it is recommended that you get any vaccine that's available to you, but also that either scenario is effective, because in this trials they've seen that there's really efficacy of about 95.6% when you're boosted from your original vaccine series. And just quickly looking at the number of people who have been boosted and what's happening in our country right now, and just comparison, side-by-side comparison of which vaccines people are choosing. This is just showing you the stats of the number of people who have received the Pfizer-BioNTech, Moderna, or J&J vaccine. And for the most part, people are sticking with their primary series. Again, I would say that if you've had the Johnson & Johnson vaccine, and even globally, if you've had AstraZeneca vaccine, people throughout the world have been boosting with mRNA vaccines following the viral vector vaccines, and they have seen significant improvement and enhancement in their immune response. And the same goes for America and for the US, where if you've had the Johnson & Johnson vaccine, and if that's followed, the studies have showed if you follow that up with the mRNA vaccine, the boost to the immune response is pretty significant with that. And so that is something that is readily available. But again, sometimes people have preferences and reasons why they want to take one vaccine over the other. So at this point, the general recommendation is that you can mix and match and choose whichever scenario works for you. Now I'm going to just shift over to talk quickly about COVID-19 and children and the pediatric vaccinations, because I know this is something that is on everyone's minds. So as of mid-October 2021, children ages 5 through 11 have experienced more than 8,300 COVID-19 related hospitalizations and nearly 100 deaths from COVID-19. In fact, it's unfortunate, but COVID-19 has ranked as one of the top 10 causes of death for children ages 5 through 11. It's also important to note that children who get infected with COVID-19 can also develop serious complications like MIS-C, multisystem inflammatory syndrome, where different parts of the body are inflamed, including heart, lungs, kidney, brain, skin, and many, many more. There's been more than 2,300 cases of MIS-C in this age group specifically. And obviously children we found with underlying medical conditions are at more risk of severe illness compared to children without underlying medical conditions. As of November 25th, nearly 6.9 million children have tested positive for COVID-19 since the onset of the pandemic. There's been nearly 132,000 child cases that were added just in this past week. And child cases had declined recently after we had our surge in our summer and then started to plateau. But COVID cases among children still remain extremely high. It's all relative. And we can see here that for the 16th week in a row, child COVID-19 cases are above 100,000. Since the first week of September, there's been additional 1.85 million cases in pediatrics. And besides MIS-C, what are some of the other complications with COVID? Let's not forget about long COVID. This is something that is affecting so many people around the world and in our nation. About 11 million people were reported as having living with long COVID in just the US. And it's reported that over half of 236 million people who have been diagnosed with COVID-19 worldwide are suffering with symptoms of long COVID. And this is really important to remember, because even if you've had mild disease, or even if you've been asymptomatic, you can still have symptoms of long COVID and suffer, unfortunately, with disabling disease. You can have symptoms such as difficulty breathing, shortness of breath, feeling extremely fatigued, tired all the time, after minimal exertion, having a persistent cough, having irregular heartbeats, cardiomyopathy that we hear about so much when, it was brought up with vaccinations. Well, viruses give you cardiomyopathy, and SARS-CoV-2 is a virus that definitely gives you cardiomyopathy. And that cardiomyopathy, unfortunately, may not be reversible from this disease. You can have a lot of sleep disturbances. People have complained of a lot of neurologic symptoms. They have anxiety, sleeplessness, they have depression. There's a lot of changes that have been proven to happen in the brain of patients with COVID-19. And so there's a lot at stake here, and people are suffering. And what's important to remember is that we don't have a cure for long COVID. We don't have something that just reverses everything. So this could be really detrimental to not just adults, but kids that are suffering with this as well. If we look at the vaccines in children, now we know up until this point, we were vaccinating adults. We were vaccinating initially 16 and up, and then we were able to vaccinate our 12 to 15-year-olds. And then we were anticipating the approval for the vaccines for the 5 to 11-year-old age group. And once this trial data was made available, in fact, actually, the data was looking very promising. All of the vaccine had actually met its safety and efficacy profile, but the FDA actually wanted longer time frame. They wanted more children to be enrolled in these trials, and they wanted a longer time frame just to make sure that there was no potential for this very rare side effects of the myocarditis that were seen in the male adolescents. And the vaccine dose was actually dropped and lowered to 10 micrograms for the 5 to 11-year-old. And what they found was that in these 3,100 children that were aged 5 through 11 who received the vaccine, there was really no serious side effects that were reported. It was about 90% effective at preventing COVID-19. And it was comparable, if you compared it to the 16 to 25-year-olds, and it was really well tolerated. And I think that was really, really important from this trial. Now, there's always these concerns that come up about the safety of these vaccines. We have to remember that initially we talked a lot about anaphylaxis and allergic reactions after these vaccinations, and this was extremely rare. We're looking at 2 to 5 per million cases that were reported. The myocarditis cases that were reported were also extremely rare, noted to be more in male adolescents. Again, all of these patients had resolution of their symptoms as opposed to actually having SARS-CoV-2 infection. We know that they can have prolonged disease and sequela from that. So that was also something that was really important to note. But at the same time, the pediatric dose from 5 to 11-year-old being decreased, the hope for that is that there are going to be no cases of this with this pediatric dose. Again, it was extremely rare, as I mentioned before, less than 200 cases per million in the fully vaccinated males and only about 30 cases per million in the females in that age range. And again, as I mentioned before, you have to think about the risk versus benefit of long COVID or sequela from actual infection with COVID-19. And in the pediatric trials of the children from 5 to 11-year-old, there were no reported cases of myocarditis in those children. Now, this is looking at what's happening with the vaccinations in the different age groups. So again, I just wanted to highlight here that at this point, we've had about 5 million kids have been vaccinated in the ages from 5 to 11 with the COVID-19 vaccine. And so far, there's been no major safety signals that have been reported. And that's really important to remember. And as these vaccines keep getting rolled out, I think we have to keep these things in mind. There's about 28 million children who are eligible in that age range. So we still have a ways to go. But within the first week, we saw that about 1 million kids had already been vaccinated. And I think this was really reassuring. And I think this is something that's really important to remember, especially in the context of Delta, which is already surging in our country, but Omicron, which is now being identified globally, and what that means. We see that younger children are being affected a little bit more in South Africa. Will that pan out to the same thing in the US or globally? We don't know, but we definitely have tools right now to protect children. And I think we have to use all the tools that we have in our toolbox. This is, again, just looking at the children who have been vaccinated and just comparing the side effects that have been reported in the trials. And I think this is really good to highlight that children in this age group actually did much better, even better than the adolescents with the side effect profile. They had, minimal systemic symptoms compared to even adolescents or adults. They had less fevers. They had more frequency of injection site reactions and soreness, but they had less fevers and chills and systemic symptoms that were reported. So it was really well tolerated. And again, like I mentioned before, there were really no cases of myocarditis that were reported. So where does this bring us? This brings us to all of our unanswered questions. What do we know about Omicron, and what do we know about Delta? And what's going to happen in this stage of the pandemic that we're in, Omicron versus Delta? The big questions that we had were, are our current tests adequate? Will they pick up this variant? Will we know? Or is this variant going to be something that later gets classified as a variant of high consequence, which misses our testing capabilities? But at this point, like I mentioned before, there's no reason to think that our testing strategy will not be effective. In fact, we have been picking up cases. So hopefully it stays that way, but that is definitely the sign that we're seeing at this point. Is this variant going to be more transmissible? Is this going to have a higher R naught? We talked about this before, and we've seen that with every variant that emerges, each variant ends up being more and more transmissible. And what does this mean in the grand scheme of things? Well, the easier that it is to transmit, meaning the less time that you need of exposure to really acquire the disease, the more people potentially can infect. And when you have so many people throughout the world who have not been vaccinated, as I showed you before, and the amount of virus that we have in our communities, and with the amount of surging right now just with Delta, we don't know. This could be potential for Omicron to, really take hold. Only time will tell us. We've seen other variants before that were also concerning. We had beta before that was very concerning. We had mu that was concerning. We've been watching these globally, but none of these panned out. They sort of stayed locally. We had to worry about beta in South Africa, and it really never took off. So we won't know that for some time now, but we are keeping a close eye on what's happening with Omicron at this time. What's going to happen with our therapeutics? This is a question that we really had before. Are our current treatments going to be effective against this variant? We've made significant strides in the past 2 years against this pandemic, against this novel virus. We've developed some monoclonal antibodies that have been targeted specifically at this virus and at the spike protein, and they have been effective at really preventing progression of severe disease. And they've been really effective. Now, the concern is, with this new variant, with the amount of mutations that there are on the spike protein, will our current monoclonals take a hit against this variant? Well, that is definitely a concern that seems likable, plausible. And the thing is, we have 3 different monoclonals right now from 3 different manufacturers. And the great thing with science is that we have had so much advancement in our science that we have the ability of modifying things. Right now, it seems like it's possible that 2 of the monoclonals may be less effective and 1 may still hold up. But again, time will tell, because as we speak, the manufacturers are testing these monoclonals, and we'll have more information on that. With respect to our vaccinations, what does this mean for our vaccinations? Again, this is something that is really the big question mark that people are thinking about. And I think, as I mentioned before, each variant that has emerged, during this pandemic, we have seen that our vaccines have really held up, even despite taking a hit in efficacy. We've seen that they've still provided a lot of protection to prevent that severe disease and prevent that hospitalizations. It's most likely the case that this is, we had come to the conclusion that this would be a 3-series vaccine, or J&J would be a 2-series vaccine. But we, only time will tell us. But what we have learned with science on our side is that boosting our immune response will give us significant amount of protection and longevity of protection. And so the first thing that should be is vaccinating people who are unvaccinated, because this is how we get ahead of this virus to begin with. It's because of the scale of global inequity in vaccines that we have so much virus that's still transmitting around the world. And while the virus is out there, it has a chance to infect more people, to go unchecked, and there will be new variants that will constantly be emerging. So our primary goal is to vaccinate people who are unvaccinated. People who have recovered from infection should also get vaccinated, and people who are 6 months or 2 months out from their J&J vaccine should also get boosted, so that we can really enhance our immunity and get ahead of this before, if Omicron does take over, or just even to have protection because Delta is surging. There's so much virus that's around here. But the manufacturers of these vaccines companies are working right now on testing this specifically in the lab. So we'll know specifics about how effective these vaccines are. And again, the important thing to remember is that all of these vaccines can be tweaked in a relatively short amount of time, and new variant-specific vaccines can be produced, but it will take time for that to happen. I mean, it won't take time for the vaccine to be manufactured. That seems to be much quicker, but for it to actually be available for people to have will take time. So while we're in the state of significant disease globally and nationally and exposure risk, we really shouldn't wait for that. We should get boosted if we're eligible. We should get vaccinated if we're not yet vaccinated, to really protect ourselves. And what's going to happen in our communities? We're already seeing that there's so much community transmission. We have so many cases in our country. There's going to be a lot more cases. It's really pretty much not a mystery anymore that the virus has been transmitting in the communities for some time now. What happens in our near future, time will tell. So potential consequences from this, we are in a Delta surge right now. Potentially, we can continue to be in our Delta surge. We are also seeing increasing in influenza activity right now, more than we had last year, which is not surprising, but we were worried about a twindemic last year. Will that happen this year? We are seeing rising cases of Omicron here and globally. What will happen? Will that plateau? Will that drop off? Will Delta still dominate? Will there be two variants that are playing out simultaneously, where one will affect a certain subset of people more, and the other one will affect, people who had natural immunity but are not protected and may be getting reinfected, or younger population? Will we have two different variants that are competing simultaneously and creating so much disease worldwide? We don't know. These are all the questions that we have yet to answer. And like I said, time will give us that information. So what can we do in the meantime instead of sitting here and panicking? The most important thing that we can do is use the tools that we have in our toolbox. We know the things that are effective in preventing disease transmission and protecting ourselves. The first thing is vaccinations. Make sure you get vaccinated if you haven't been yet, and everyone ages 5 and up really should be vaccinated, especially children. As I mentioned before, they are susceptible. This is a disease we've seen in kids, more than we've ever wanted to see. So that's important, and get boosted if you have not been yet. And then use your non-pharmacological interventions that we know work. We know masks work really well. Find a high filtration mask and use it. At this point, really nobody should be using cloth masks unless you really don't have access to any other type of mask. Surgical mask is better. Make sure it's well fitting. KN95 masks have better filtration, and obviously N95 masks, if you're in healthcare. But try to have good mask all the time, especially based on the kind of environment that you're in. If you're indoors in crowded areas, especially in the winter time now, you really should have higher filtration masks. Try to, make sure you have adequate ventilation. We know that's key in this, so whatever environment you're in, promote good ventilation, promote distancing, hand hygiene. Testing is a key to all of this. If you have symptoms, you should get tested. If you've been exposed, you should get tested. If you're positive, if you're not feeling well, you should stay home. So I think all of these strategies that we have in our toolbox that have worked before will continue to work regardless of which variant we're dealing with. So we have to remember to really use that layered approach. So it's going to be vaccinations and all of our non-pharmacological interventions of masks, testing, ventilation, and staying home if you're not feeling well. And I think that is how we are going to be in the best position right now to get through this.
Thank you, Dr. Syed. That was a wonderful presentation. I mean, honestly, it's covered through a lot. And as we know, science literally is evolving day to day. So we really appreciate you giving us background on the Omicron and trying to understand the data behind the boosters, as well as how the vaccinations have impacted the children. I do want to focus specifically on the pediatric population right now, because I think one of the biggest barriers that we're having right now, whether it's in our minority communities or just in larger communities in general, is that even if the parents or the adults are vaccinated, they still are hesitant about vaccinating their kids. And as a mom myself, and I'm sure you as well, what advice would you give to these parents? I mean, of course, our kids are our cherished, like prize and treasures. So what advice would you give, and why are you not afraid of giving the vaccine to your own kids?
Yeah, I think that's a great question. That's a wonderful question. And we knew that this was going to be a challenge, especially for the younger children, because we saw that there was hesitancy with the adolescents, and so we knew that parents would not feel comfortable immediately to vaccinate the 5 to 11-year-olds. And, as a mom, I completely sympathize and empathize, and I get it, but we have to think a little bit less emotionally and more, scientifically, in that sense, that we have to remember that what is the primary goal? The primary goal is to protect children who are susceptible. We've seen far too many children be hospitalized. We saw it firsthand with Delta. In the beginning with our wild type virus, we thought children were not being affected as much. Again, there were so many different variables for that. Schools had shut down, kids were home, they didn't have the exposure risk, but all of that has been in flux and all of that has changed. Now, for the most part, we do see that children are doing better than adults, but that's a gamble, that's a risk. Like I mentioned, we still had way too many children that are being hospitalized, that are needing ICUs, that have died. No child should die from something that's preventable at this point, and we're dealing with a vaccine preventable illness. And not to mention that even those children who are asymptomatic or have mild symptoms can develop long COVID. And I have seen so many children who are just suffering, who cannot concentrate in school, who cannot play their sports, who cannot have the usual activity that they used to have. I mean, children are supposed to thrive. They're supposed to, you want them to be in their best ability, their best shape and form, so that they can continue to grow and be their best selves. And this is not the kind of scenario that we're in. Every day that they're not protected is a risk to them, especially with the amount of virus that we have in our communities. So the data has shown us that these vaccines are safe and effective. They have been gone through, there's been tremendous scrutiny on these vaccines in a very transparent process where so much the data is just readily available. And the FDA even asked for a longer duration of data so that they could watch even more closely in this specific pediatric population. And they wanted more children in the trials. So, there's been a lot of data. And at this point, we're talking about 5 million kids who have already been vaccinated, in addition to the children who have been in the trials. So there's been no major safety signals. And I think that's something that people can really, feel comfortable in, comfortable with, is that, we have a lot of disease, a lot of virus in our community right now, and every day is potential for exposure. We don't know what's around the corner next, but you don't want to take that chance with your child who could be susceptible. And the only way we're going to get ahead of this is by vaccinating people, and children, like I said, should be protected. And I can speak personally for myself. My 8-year-old has been vaccinated. He actually now is considered fully vaccinated, almost a week out from his second dose. So in one more week, inshallah, he'll have full immunity. And so, this is something that, as I said, as a mother, I've been watching very closely. My 17-year-old got the vaccine when she was 16, when she was eligible, and she tolerated it, again, following the science, watching everything, being on the front lines. As you're aware, we see so much disease, so much disability, so much death. And, even seeing teenagers dying from this is something that is not acceptable, and children are so innocent and they need to be protected. And I think that's something that we can really feel confident with, is that, this is being monitored and being watched very, very closely. And these vaccines have gone through a lot of scrutiny, and it's a transparent process. If there's any safety signals that come up, they will be flagged just as they have been before, just like those rare cases of myocarditis. They were watched very, very closely. And, there is a process, there's checks and balances in place in all of this.
Exactly. And then I think one of the things that we do want to highlight is people talk about, yes, you have the short-term data, but we don't really know long-term wise, is this going to cause cancer? And I know there's a lot of other conspiracies out there. But I think, just to kind of give a little bit light so people can feel this heavy weight that they have, like, am I giving my children something that they will have to suffer from later in the future? What would you say to that?
Yeah. That's a great question. Great point. I'm glad you brought that up. We heard this even with the adult vaccines, initially. So it's not surprising that this carries on into the adolescents and into the pediatric vaccinations, because again, people, they want to do what's right for their children, completely normal, logical way of thinking. But if we look at the science, and if we look at the scientific aspect, any vaccine that's ever been developed, that's been used for centuries, for decades and decades, we've been vaccinating people. There's no long-term side effect of vaccines that can happen after the first 6 weeks. Usually, that's when you find the most common, potential side effects of vaccines happen in the first few weeks, really. And so far, with the adult vaccines, with the adolescents, there's been nothing that's been reported of that sense. We're, almost a year into vaccinating the whole world at this point, and there's nothing. These vaccines are not meant to, like I said, there was a lot of conspiracy theories, as you mentioned, that came out when these vaccines were first developed, that your mRNA is, going to alter your DNA and, all these things. And we know that that's not true. We know that these are just at the injection site. They tell your body to make a protein, and then they're disintegrated by your body. So they're not hiding out in your system anywhere. They're not going to reactivate or give some complication years down the road. It's really that short-term time frame where you expect to see any potential side effects from these vaccines. And after that, there's really never been a vaccine that gives you some side effect years later. It's just not scientifically possible or ever been really seen or documented.
Thank you. And honestly, I know we're running short on time. I just wanted to give the viewers a very nice little story behind this. So the way Dr. Syed just pointed this out, I had a work colleague who rephrased it very nicely. He said the mRNA is like a mailman. The mailman comes and delivers a package for you, right? Or he gives you something that you really need, but then eventually he has to go away. It's not like he's going to stay at your house the whole time. So it's the same idea and concept with the mRNA. It comes and it does its function, helps the cells understand, helps your body start preparing in case, it needs to learn what a COVID attack is, and then kind of like leaves. So again, yes, in terms of the safety, I think sometimes we just have to relate in a nice humorous way for people to really understand, like, oh my gosh, that's it. It's that safe. So I thought that was nice. So I just wanted to share that with the viewers. Thank you so much, Dr. Syed. I think this has been very helpful. If you have any closing thoughts or advice for anybody, what would you say before we end this conversation?
Yeah, it's my absolute pleasure to be here again. And thank you so much for hosting, all of these webinars that are really important for the public. I think I want to leave people, I put a lot of information out there, maybe a little too much information for people at one time, but I just want to leave people with a little bit of peace. I don't want anybody having a lot of anxiety or a lot of fear, because there's so much in the news all the time in the past 2 years with this virus, with this pandemic, that there's always, a level of anxiety every time there's something new happening, and I want people to know that we are not back to square one by any means. We're not at, January, February, March 2020, where we had our first wave. We're not in the situation where, everything needs to necessarily shut down and life comes to a halt, right? We have made so much progress and we have come so far in nearly 2 years. We have vaccines, we have therapeutics, we know how this virus spreads, we know masks work, we know we have so many tools that we can use. And not only that, we have, like I said, science on our side, where if something's not working, it can be, tweaked a little bit. Our treatments can be adjusted, our vaccines can be adjusted. So there's a lot to be positive about, in the grand scheme of things. And if we use these interventions, like I mentioned before, and are just, smart about, when the virus is circulating too much, we're a little bit more careful. When there's less virus in our community, then we can relax a little bit more and just know that life doesn't have to stop, that we can keep going, and there will be an end to all of this, but we just have to get through each, phase at a time, and just remember that, it's not the end of the world or, back to square one where there's so much unknown. We know so much about this virus at this point, and we will keep making strides.
Thank you. So with every hardship comes ease, as it's well said before. And for all the viewers, we hope that you have a wonderful holiday season, a safe, healthy one with your friends and families. And thankfully, you know, it's not like 2020. So please stay safe. Thank you so much for joining us at IMANA. And thank you again, Dr. Syed, for all of your time. Thank you again. Have a good night, everyone. Take care. Bye. Assalamu alaikum.